As we step into February, we're excited to talk about Heart Health Month. In fact, I'm wearing my red today in honor of my heart. With us, joining us today is Dr. William Borden, who is a cardiologist at George Washington University, specializing in preventative cardiology. Thanks for joining us today, Dr. Borden.
Thanks, Sue, for having me, and thanks for having this focus on heart health. I forgot my wearing my red today, so I'm glad you did.
I did, yes. So let's get right to it because I think it's important that we talk today about some lifestyle factors that can promote heart health, things like nutrition and exercise, and then maybe even debunking some myths out there because there's a lot of misinformation, I think, on the internet, and it's helpful to point people in the right direction toward what really matters for their heart health. So kick us off with perhaps the five best lifestyle practices that can help anyone improve their heart health.
Yeah. Well, it's a great question, Sue, because there is so much that each of us can do with our day-to-day, with our lifestyle that can really prevent heart disease and for people who have heart disease to prevent, future complications. So to dive right into it, the first is to eat better. And we can go into a little bit more about healthy diets. But essentially, it's eating lots of plants, vegetables, fruits, lean protein, and avoiding those saturated fats and concentrated sugars. So that's one. Two, be active. Get active, and we're going to talk through that some more as well, I think, and get through specifics around activity. Three is if you smoke, quit. And if you don't smoke, don't start. So quitting tobacco is really a key one. The fourth is really to get enough sleep. So we've seen more in recent years the importance of sleep, and I know that can be difficult, and there are a lot of ways and approaches that can be taken to improve sleep, but really trying to get 7 to 9 hours of sleep a night. And then the last is to reduce stress in our lives. We all need to take care of both our bodies and our minds and make sure that we're managing the stress that comes up day to day.
That's awesome. Those are all like my top five favorite things to talk about too. So it's so great that you mentioned all of those. So let's dive into diet and nutrition. It's not a new concept. I mean, everybody's been told their whole lives you need to eat good or and eat heart healthy things. So can you maybe give us some examples of some good foods we could eat or things to avoid, stuff like that?
Sure, absolutely. So it's interesting, the research on diet can be confusing at times, right? I think we've all seen, TV reports, and one day it's telling us coffee is good, the next day it's telling us coffee is bad. And so, it can be complicated because we don't all just eat one thing. We eat a combination of different things, and we eat it in different environments. Are we eating it in a rushed, stressful environment, or are we eating it in a relaxed environment? And so, I think that the best research, the best advice out there is about dietary patterns, like a grouping of diet foods to eat together. And I'm going to talk about three, just so that you're familiar with them. So the one, and I think this one has really some of the best research behind it, is what's called a whole foods plant-based diet. So whole foods meaning not processed foods, but eating an actual apple or lettuce. And it's really focusing on plants, so vegetables, fruits, whole grains, plant-based proteins like soy, beans, or nuts. I think is really sort of optimal. If you do add in animal proteins, preferably more like fish, turkey, or chicken. So the second diet to mention is one that's pretty similar. It's called the Mediterranean diet, although it has a little more flexibility in it. So it's similar, lots of vegetables, fruits. It has some low-fat dairy, a little bit more lean protein like fish and chicken, um, and often, cooking with things like olive oil. And then the last one I'll mention is the DASH diet. And the DASH diet is very similar as well to the Mediterranean diet, but with a little more of a focus on reducing sodium or salt in your diet.
That's easy. That's not that hard to follow, really. It's more about maybe eliminating those things that, we're just habitually eating, like sugars and saturated fats. And, if you just stick to the whole foods, I think that's a winning strategy.
It is.
Um,
And And the other thing I would say is, look, we all have to enjoy life, right? And food is an important part of celebrations, socialization, religion. There's so many different parts of life that food is important. And so, I don't think people have to be an absolutist about it, that they
Hmm.
can never, enjoy a good piece of cake, or if it's their birthday when they want to have a steak, go for it. But it's what you're doing on your day to day. And I think if you think about your day-to-day choices that you make, is really making them mostly plant-based.
Right. I think that's great advice. And like you said, you just have to think about just what you're going to eat right in the moment, not stretch it out like, oh my gosh, for the rest of my life, I can never have a cheeseburger. It's not about that. It's the next best choice, right? That you can make in your day. That's great advice. Okay, so let's talk about some possible myths or misinformation about heart disease. Can you maybe list five or so of the most popular myths and we can debunk them?
Sure. Um, well, I'll give you a couple here. So one is a common one is that people know if they're at risk for heart disease. And you may know, if you have, say, if you're an active smoker, you probably know that puts you at risk for heart disease. But some of those risk factors you really need to get checked for. So things like high cholesterol, getting your blood pressure checked, getting your blood sugar checked to check for diabetes. And so a person may feel completely healthy. They may not feel any symptoms, but be at risk for heart disease.
Mhm.
So it's important that, in addition to the healthy lifestyle, that you are following up with your doctor to make sure you're getting checked for these things. Two is that a heart attack always has chest pain. That is not always the case. Chest pain is the most common way that people feel a heart attack, but it's not the only way. And so people may also feel shortness of breath, they may feel nausea, they may feel sweaty, or just really a really deep tiredness. And often this is with some sort of exertion or exercise. And typically it gets better when you rest, but if it continues, that's a reason to call 911. The other thing I tell people is to keep an eye out for is, gee, I just can't do what I could do 3 months ago. I'm using the treadmill or the elliptical, and I can't do the same amount of time, or work is hard. Those would be reasons to get in touch with your doctor and to talk it through. Um, and then I guess a third one that I hear commonly is, if I take a medicine, then I don't have to worry about healthy diet and exercise, right? I'm taking my statin for my cholesterol, my numbers look great. I can just eat whatever I want. That is not the case. And in fact, even in addition to the medicines, healthy diet and exercise have so many benefits for us all that it's really important that you focus on that diet, exercise, the stress reduction, the sleep, the quitting smoking, in addition to taking the medications.
That's wonderful. Thanks for those tips and debunking those myths out there. Let's talk about one of my favorite topics, which is exercise.
Mm.
What types of exercise are most beneficial, and how can someone get started exercising who maybe has been inactive for a while?
Yeah, thanks, Sue. I share your passion for exercise. It has so many benefits, not the least of which is it makes us feel really good. So exercise is incredibly important. In terms of heart health, aerobic exercise is sort of the key portion of it. And we talk about that aerobic exercise. This is something where you're getting up and moving, you're getting your heart rate up. And we think about it as moderate exercise or vigorous exercise. Moderate exercise is things like brisk walking, water aerobics, even something like gardening. And that is perfectly fine. You don't have to, be in an intensive exercise class and be breaking a huge sweat. A brisk walk is great. If you're doing moderate exercise, you should be doing 150 minutes a week. So 50 minutes 3 times a week, or 30 minutes 5 times a week. So really most days of the week. And I like to say if it's a brisk walk, if you're, outside, make sure it's a brisk walk. You're not stopping to look at the flowers all the time. You can do that too, but you should try and get that 30 minutes of uninterrupted walking. If you are doing vigorous exercise, something like running or swimming laps, then it should be just 75 minutes a week as a minimum. So again, 150 minutes a week as a minimum for moderate exercise, 75 minutes a week as a minimum for more vigorous exercise. But it's not just aerobic exercise training. It's important that we also do strength training. And this can be, either resistance training or weight training. And Sue, I know that you have many great programs where you can work through this and help individuals with their strength training as well as their aerobic exercise. And strength training should be at least 2 times a week. And that's important for your cardiovascular health, but also your balance and preventing injury and many other benefits. And look at adding intensity over time. So pushing yourself a little bit. You want to listen to your body, so do what feels comfortable. Exercise should feel good, and you should feel good after you're done exercising. But you can push yourself a little bit over time. And the last piece I would just say is that just move more in general. So any activity is good activity. Those choices you make that, you're walking someplace and you take the scenic route and it takes you an extra 5 or 10 minutes, that's great. If you can take the stairs instead of the elevator, that's great too. So any movement that you make is good movement. And then Sue, to your other question of how do you get started? So you want to listen to your body and you want to build yourself up slowly, particularly if you have not been exercising. So start with a walk. If most you feel comfortable with is 5 or 10 minutes, and start with that and do that for a week, and then start to increase over time. Again, always listening to your body. If it doesn't feel right, if you're short of breath, certainly if you have chest pains, slow down, stop, and you want to let your doctor know about that. And then, so I'll just put in a plug for you and what other therapists do is that there are a lot of great therapists, really experts out there that can help you with exercise programs to get you up moving in a safe way.
Yeah, there's a lot of people who feel nervous about getting started because it's uncomfortable, you know. But as somebody who's exercised my whole life, like discomfort comes with it, and I'm not talking about some kind of cardiac, that kind of discomfort, but I'm talking about just like it might not be fun in the beginning, and it takes a little while to get acclimated to that level of exertion. But so if you don't feel comfortable doing it on your own, certainly a therapist or a really good personal trainer could help you achieve, some goals along the way.
Absolutely.
Yeah. All right. Well, thank you for that. That's wonderful. So let's talk about stress. I think stress is one of those concepts that we kind of use kind of vaguely. We don't really understand it, except that, I know when I'm stressed out, but we don't understand really the effects of stress, what it can do to our hearts. So do you have any, effective ways to manage stress and maybe tell us why that's so important?
Stress is really important. This is something that I talk to my patients about on a regular basis. So we know that stress can increase inflammation in our body and increase certain stress hormones that can lead to more cholesterol plaque buildup in our arteries, can lead to heart attacks and strokes. And in fact, research has shown that even, stress reduction programs can not only improve our mental well-being, so it's important for us to feel better and not be suffering from that stress, but also improve things like blood pressure and other markers of cardiovascular health. So there are a couple of things that I think we can all do to manage stress in our lives. So one is one that Sue, you and I have talked about already, which is exercise. Exercise is a great stress reducer. It releases all kinds of wonderful hormones in our body that really make us feel better. So exercise is the first one. The second are programs like yoga, which reduce stress, but they also have benefits in terms of your strength and balance, flexibility. So yoga is another great resource that you have available to you. The third, I would say, is meditation. I'm a big fan of meditation. I do meditation myself from time to time. And in addition to classes and people helping you to guide you through meditations, there's some really great apps out there that you can use. There's one called Headspace, one called Calm. I don't have a particular preference. You could try different ones. But these can be really helpful. And they can have ones as little as, 5 or 10 minute meditations that they can help guide you through, which can be really helpful in reducing stress. The last thing I would just say is that if the stress is really overwhelming or just, is not something that you really feel you can control and is impacting your day-to-day life, please get some help. So talk to your primary care provider, go see a therapist, a psychiatrist, because it is so important that all of us take care of both our mental health as well as our physical health.
Well, that's certainly good advice. I wish I was better at meditating. Um, but I think one of the things that helped me is when I learned that meditation wasn't just about relaxing. It's not about I just can't relax my mind. Well, that's not the point. The point is learning what to do with a busy mind and how to channel that energy into certain places. And it's just something you learn how to do. It's not something that, you have to be good at day one. It takes some practice and it takes a lot of effort. So it's not one of those things where you're expected to relax in the first 5 minutes of, it's a different kind of exercise, but I think it's hugely valuable. So thank you for sharing that advice about stress management. So finally, what advice do you have for people looking to stay heart healthy as they age? Are there any specific things they should keep in mind as we get older and get into the later stages of life?
Yeah. I think that one of the things is that the interventions that we've talked about for heart health, they work at every age, and it's never too late. I think that, there are people who already have heart disease. They may have had a heart attack in the past. They may have had stents or bypass surgery. I take care of many patients who've had these things, and they're living great quality lives for many years because the interventions that they're taking, both a combination of the lifestyle aspects we've talked about, but medications work incredibly well to prevent heart disease and prevent future heart disease in people who've already had it. And so I think it's never too late to make a change. I think that's kind of my prime message here. And sometimes it's a matter of making incremental changes. Sometimes people are able to change everything, completely in the blink of an eye, but most people can't. And so it's taking those little steps each day to say, what can I do to be a little bit healthier? We've talked about diet and really shifting more towards a plant-based diet. Doesn't have to be 100%, but shifting towards it. We've talked about exercise and shifting towards getting moving in little ways, and then also committing to working to get yourself into a regular program, to stress reduction. We've talked about sleep and trying to get 7 to 9 hours of sleep. And if sleep is a problem, um, to either talk to your doctor or look at different resources, different ways, just easy steps that each of us can take to help with our sleep. And the last thing I would just say, which I think is so important, is we all have to enjoy life. Being with family, being with friends, doing activities that we enjoy, keeping ourselves stimulated and active, is really so important to all of the things that we've talked about. And so I think working on all of these things at any stage in life are really important. And I think that you will easily feel the benefits from it.
Yeah, that's wonderful. I mean, it's really none of this is really very hard, It's just a matter of doing it. Like you said, enjoying your life, doing the activities that life brings your way, and making choices as best you can along the way. So Dr. Borden, thank you so much for all these helpful tips. It's really definitely going to resonate with our community of listeners who are interested in keeping their hearts healthy as well. Um, is there anything else you want to add as a closing thought? I think you've summarized everything really well.
Well, I would just thank you, Sue, for the work that you do in highlighting heart health. And for everyone, take this month of February to refocus on heart health and to make those changes towards a healthier lifestyle for you and encourage your friends, your family to do it as well. Be a positive change agent for better heart health. So thank you so much for having
Well
me.
said. All right. Thank you, Dr. Borden. That was fantastic. Everybody go out and eat better, move more, sleep more, manage your stress, stop smoking, all those things Dr. Borden mentioned, and do it now. But so thank you, Dr. Borden.
Thank you.